It is my great delight and absolute pleasure to introduce you to a very unique person today. But let me share one of my own experience before I tell who she is. Many of you already know who she is. A few years back, I was selected to be potential nominee to win what is known as Priscilla Kincaid Smith Award by Australian Medical Association. I unfortunately did not know who late Professor Priscilla Kincaid Smith was at that time, but it was sort of like the Oscar nomination, and there was sort of 5 of us. They were advertising, so we were invited to come to the function. So I obviously did my homework and I read who she is. Priscilla Kincaid Smith was a brilliant clinician scientist, first ever woman professor in medicine that Australia ever saw. The interesting thing is, when she came back to Australia as a well-qualified senior nephrologist from UK, the Australian government and all the male-dominant academics told her that in Australia, we don't want women to work. In Australia, their job is to get married, produce children, and support their husbands to do their work. But late Priscilla Kincaid Smith was not going to put up with this sort of a story. She did fight for 10 years. Interestingly, I was a few years old by that time back in rural Sri Lanka. My mother, who studied up to grade 8, basically had strict rules. Me and my sister, there was absolutely no difference between us. We both had to do dishes. We both had to climb trees. We both had to do all household chores. Now you might wonder that what the hell that this has got anything to do with the speaker or the guest that I'm going to introduce you to. Well, Dominique Cadilhac is a unique person. She's Professor Dominique Cadilhac. She's one of the world authorities in healthcare quality, the health economics in relation to stroke. To tell you how good she is, if you pick up the first ever copy of Lancet Neurology, you would see her name as an invited author to write a commentary on the Lancet Neurology launch issue long time back, well before I was qualified even to be a neurology registrar. So Dominique is certainly a household name in stroke field globally. Professor Dominique Cadilhac, it is a delight and pleasure and honor to have you on behalf of World Brain Day team, World Federation Neurology YouTube channel and social media team. My first question to you, tell us how you came to Professor the Dominique Cadilhac. What was the journey like? So start from your first the degree and career, and how was the journey like? I am sure the journey, although it was probably not as tough as for late Professor Priscilla Kincaid Smith, who went on to become a really big name in the world and made enormous amount of contributions to the world and promoting brain health also, despite she being a nephrologist. So take us through your journey.
Thank you very much, Tissa, for inviting me to speak about my career as a neuroscience nurse. I trained in a hospital, and I certainly never thought I would end up spending most of my career working as an academic in a university. My first graduate position meant that I was working in medical wards and I was looking after people with stroke. And back then I also had no idea that that would end up being my lifelong career path. I was very fortunate in the early 90s to land a full-time position with Professor Stephen Davis at Melbourne Health as his first full-time clinical trials nurse. And from that time, I got a real passion to do stroke research. And Steve was fantastic because he really, supported me to attend conferences and things. And back in the day, not many of the neurologists were taking their clinical trials nurses to attend the scientific meetings and conferences. We were really there to, enroll patients, collect baseline data, do the follow-up, but not, sort of get so involved in that academic discourse that happens at conferences. So that really piqued my interest, and I wanted to know, what was a p-value? Was it, it's not something you do in the toilet. But basically, I then went on and did a postgraduate degree, so upgraded my nursing qualifications, and then did a Master's of Public Health. And I chose a Master in Public Health because I wanted to learn specific research techniques in epidemiology, in statistics, in health economics and program evaluation, because that would give me the best foundation for really understanding research process and methods. And in that time, I wrote 2 papers. My first paper in 1996 was on the role of clinical trials nurses in the process of informed consent. And then the second paper I wrote in 1998 was for the leading nursing journal. It was sort of like a magazine that we would all get, called the Australian Nursing Journal, on the changing face of stroke, medical management revolution. And this was because I recognised there was a gap. I had learnt so much from my colleagues that I felt that the nursing profession really needed to understand what was at the cutting edge of stroke research, concepts of the ischemic penumbra. And at that time, we didn't have clinical guidelines for stroke. So I took that opportunity to write what was best practice principles back then for the management of stroke. And we had such little evidence of what the nurse's role was. After my first maternity leave, I got the opportunity to work at the Stroke Foundation, which I did for 4 years, and started working on a project that I had input to the design. And this was the first project in Australia that allowed us to compare different models of care. So what was the advantage of a stroke unit where you've got co-located beds and an interdisciplinary team that is specialised and only looking after strokes, contrasted to a mobile stroke unit, which is not an ambulance. Back then it was a roving team of interdisciplinary team, usually a physiotherapist, a nurse and a neurologist and junior medical officers, who would go and see all the patients across the hospital that had had a stroke and provide some advice. And then we also had another group that we were contrasting to that had only ever provided care in a medical ward that didn't really have any specialist medical nursing or allied health input. So after that project, I really had to make a decision, because I was also doing some policy work at the Stroke Foundation, and I did really well in my master's degree, and I was offered a position where I could do a PhD, and I was very much encouraged by Professor Donham when I went to work for the National Stroke Research Institute, that if I got my PhD, it would really really help me make headway in areas I was passionate about, because I would be then able to drive my own independent research career by being able to apply for grants and write publications. So if you look at the types of research that I do, it's mainly health services research. It's a lot to do with how interdisciplinary teams provide care and how we use technology to enhance the patient experience, as well as, I have a national role in leading the Australian Stroke Clinical Registry and ensuring that all hospitals understand whether or not they're delivering best practice care, and how that then relates to outcomes for patients 6 months, down the track. So this research career in neuroscience has really allowed me to align my nursing, public health and implementation science training and interests.
Dom, thank you very much for that. I think the audience must know that you are a family woman. You raise beautiful children, and I remember after your PhD, while you were struggling with a whole lot of demands, you still had to do finances for your husband with probably no salary also. So one of the complaints that most of the medical, nursing, allied health colleagues would tell me is how do you juggle the family, work, and rest of the other things, and then maintain an academic life also at the same time. So what is your tip to younger nurses and allied health and medical colleagues that are out there. You have supported all three groups to build their careers. I know that some of the senior neurologists end up completing their PhDs later on with the help of you, with the Australian stroke data. So what is your tip to all these groups that you still tell them that they can live their life happily and contribute to their family as partners, parents, and colleagues, and still build a research arm also? So what's the secret that you'd like to share with them?
Well, I think the secret is good negotiation skills in the family, but also having the support of your partner in that. So I did have children during my Master's of Public Health, and it took 6 years part-time. So I think one of the things to say is, you know, you will get there eventually. Take it step by step. Take a semester off if you need to take a semester off, but keep chipping away and don't give up. And keep taking the opportunities to work on projects or papers with colleagues. While I did my PhD, I still maintained a research group that was focused on contract projects. So it wasn't that I just buried myself in my own PhD. I kept my hand in other projects, and I really did do that at a stage in my life where both my children were at primary school. And I did have the support of my, you know, my partner and my parents. I was fortunate enough that they didn't live too far away, so they could, you know, help with after school and things like that. So it's thinking about, you know, I often have conversations with prospective students, often who are clinicians, about whether part-time PhD or full-time PhD would work best, depending on their life stage and other commitments. And also when things do crop up, because they always do, it's about taking a pause in good standing and not feeling bad about that. The work will continue. You know, when you get to my age now, I just realize that the years disappear. And even though 3 years might seem like a long time, or 5 years, or even 7 years, it actually goes rather quickly. And before you know it, you're 10 years post-PhD or 15 years post-PhD, and you're a professor, and you know, things have managed to fall into place, and you're still passionate, and you're still making a really important contribution. And I think the other thing is to, you know, find people to work with that will also support you from your academic interests, that have a different range of skills, and also understand your circumstances. So if you can balance that out with your primary supervisor, to have other people involved, other academics that also can bring something to value add, that's a really important, you know, a piece of advice I can give.
And the important thing is, Dom, these are really necessary. I mean, your field of interest is health services, and we both know that if we continue at this rate, when our children's children, in other words, grandchildren, when they run this society, when they earn $100, almost 99 cents out of every $100 would go back to health, as it is becoming too expensive to maintain. The only way that we can address these issues and disparities in healthcare that we didn't even touch is looking at how we deliver healthcare, and then assessing what we are doing, going back and comparing and contrasting and trying to improve and get the best value for the money that we put in. And obviously clinicians who get their hands dirty on their day in and day out, most of them would say that, oh, research is not my thing, they are there for others to do. I'm just a clinician. I get quite uncomfortable to hear this because they are the one who are seeing the problem. And then they are the one who are probably contributing to this enormous cost also. And the only way that we can leave a better world when our time comes to leave this planet is trying to improve things. And the two key things is education and research. And you touch upon all those things going through your journey, going to those conferences, building those networks, making the connections, and then negotiating with your family, and then taking time to do things. And what you probably didn't mention is be really passionate on what you do and enjoying what you do at the same time, because I have met up with you multiple times at meetings, and you're bubbly as ever. And even if you have 10 talks to give, you seems to be smiling and chipping things away. And you got to like what you do. Anything else that I did miss out of your story?
I think you've covered it all. I do believe that people shouldn't be afraid of research and what it means, and they certainly shouldn't be afraid of data. And I think anyone that's working in brain research, neuroscience research, if you're delivering services, and I know with World Brain Day, MS is the focus. I've worked with many MS nurses, and I know the role that they have is really important in supporting family members. I myself have a sister-in-law that's severely impacted by MS, and if it wasn't for the neuroscience nurses looking after her with expertise in MS, I know she'd be possibly in a very different place. And it is an interdisciplinary team effort as well. But I think, you know, if you're doing things that really work well in your service, you need to be able to collect data on that, you need to be able to evaluate it, and you need to be able to share that with others. Because what I find time and time again is that there are a lot of really good ideas or programs or clinical protocols that exist, but they never reach the surface. There's a lot of duplication going on, and we really don't know what has the best effect for achieving, you know, either delivery, you know, greater delivery of best practice care or improving patient outcomes. So for people involved at the coalface, I think it really is important that they collect standardized data, they share their data. And I know MS has a great international MS registry. That's vital to really understand the care that you're delivering and the system in which you're working with, and then how to optimize that better. Because we can't ever sit on our laurels. We have to keep innovating. We have to keep thinking outside the square. And if COVID hasn't taught us this already, we need to be pivoting and thinking about, okay, I can't see my patients face to face. They really need my ongoing support and help. How, as an MS nurse educator, might I pivot to utilising telehealth? And then who can help me set up that service? Where can I get the resources for that? And how can I work with my colleagues to really deliver a service that's equivalent to face-to-face? And then what data should I be collecting to know that it has been equivalent in its efforts? And then how can I collaborate with other centres doing the same thing so that the overall evidence base that we gather will be impactful and can either influence clinical guidelines about ways of delivering these types of practice models.
Absolutely. I think that gives me a nice segue to move to the next area of our chat, the World Brain Day. This is the 8th time that we are advocating for better brain health worldwide. This started as a very sort of a casual chat among a couple of us at a World Congress meeting, that everybody is having a day, and brain is such an important organ. The World Stroke Organization is running the World Stroke Day that seems to have taken up really well globally. And why can't we have a brain day so that we put the brain where it should be? And at that time, we didn't think that we would be reaching to 150 million people within the sort of first 7-8 years time. Having been the sort of clinician to begin with, and then academic and globally connected, when you see two powerful organizations such as World Federation Neurology and Multiple Sclerosis International Federation. World Federation Neurology is a massive organization encompassing well over 122 neurological societies from all aspects of the world, from Northern Hemisphere to Southern Hemisphere. Multiple Sclerosis International Federation is the global advocacy arm for multiple sclerosis, if you like. When you see that these two organizations are collaborating with all other members of Global Neurology Alliance, that includes World Stroke Organization also, to run a massive, ambitious advocacy campaign with the ambitious agenda to stop multiple sclerosis. How excited are you to see such a sort of a targeted campaign targeting simple people out there? Sort of our aim is to see 2.8 million social media posts from average simple human beings worldwide, endorsing and supporting and talking about brain and brain health.
I'm very excited by this. Tissa, you know, I've always felt like we're the poor cousin to cancer and heart disease and other things like that, yet diseases of the brain are a massive burden on the community and society, and are growing with our aging populations and our lifestyle choices. So, you know, it is essential that the profile comes to the forefront. If your brain is affected, whatever part of your brain has been impacted is going to affect your ability to function and whatever, you know, necessarily bodily functions that you have to perform, whether that's thinking clearly, speaking, your sense of touch. And it doesn't matter what it is. Once your brain is affected, you know, you can have temporary or long-lasting impacts that really can affect your relationships as well. Many people with neurological conditions that are chronic suffer from anxiety and depression. They are unable to return to work. So it really impacts their meaningful roles in society as well. So I'm really pleased that I'm part of profiling World Brain Day and highlighting and augmenting public awareness around why brain diseases are so important, not only to address in terms of outcomes and finding interventions to treat these conditions that are devastating to families, but also in terms of ensuring that we have good prevention for maintaining brain health. And someone who's in their midlife, you know, this is becoming more important to me. I've had members of my family experience stroke or die of stroke. I certainly don't want to end up down that path or end up with some other condition. So I want to know, what are the things I can do to help me in my midlife stay healthy, stay brain healthy, and keep on top of my game. So I think, you know, all the research that's starting to come out now is really helping to promote brain health, but also the preventative measures in which we, you know, all as individuals can start to follow, as difficult and as challenging as that might be sometimes.
Absolutely, you hit the nail on the head. I saw a very short correspondence from Professor Vladimir Hachinsky and group published in Lancet Neurology a few weeks back. It was only 3 paragraphs. You may have already seen it. He's basically asking us to look at the definition of health that World Health Organization put forward in 1948 as a complete social, mental, and psychological well-being, not the mere absence of disease or infirmity. But he wanted us to go one step further, that the definition of health itself tell the world how critically important human brain is. You cannot talk about social and mental well-being without talking about brain. The social and mental well-being doesn't come from your foot or ankle joint or knee. They come from the brain. And I think it's a timely reminder that we have to get everybody to thinking about the importance of brain health. And as you correctly pointed out, we are all in the process of getting old and increasing our risk of developing all these things that are putting our brains at a crossroad or under threat. And then you and me both know that almost 80 to 90% of the brain disorders can indeed be prevented or preventable, which we don't put a lot of attention to at times, at least. And the other thing is, given that we have almost close to 200 million COVID-19 infections worldwide at this point of time, only sort of close to 4 million deaths. They say that deaths are probably underestimated. Deaths are probably more double that amount. But despite that, you still have living people who had COVID-19. Then you and me both read reports that anything from 30 to 90%, depending on which paper that you read, these people might end up as having long-lasting symptoms, very much similar to what we see in stroke population, post-stroke population. So I think if people think that brain is not important before COVID-19. I think COVID-19 really hit the nail on the head that you cannot forget brain if you were to talk about health. And it is needed. I mean, I practice in Melbourne, on the other side of the town to where you live. We are going to get a 1.5 billion brand new fabulous hospital. I was recently told that that hospital doesn't have a neurology department or stroke service. How could you develop a tertiary hospital in first world and then forget brain completely, yet you talk about the promoting better mental health. As I said, mental health doesn't come from your foot and they come from your brain. So the advocating for better access to promoting brain health is really necessary. It doesn't matter whether you live in Australia or USA or Switzerland or most remote part of sub-Saharan Africa. Brain matters, and we must advocate for better brain health worldwide. That's the only way that we can have a peaceful, meaningful, happy, joyful world for all beings, not only human beings. Do you agree?
Yes, Tissa, I think you nailed it on the head, and it seems, like a crazy decision to have not included thoughtful planning of neurological services within a new facility. But hopefully your campaigning and advocacy might help change that with the support of others.
Oh, absolutely. The moment that I knew about it, I have gone gung-ho, and there's a separate committee within our small department, and each member has given specific tasks, and I am behind everyone behind this hospital, and I'll make sure that there is adequate representation for brain health in that department. It is not about building a kingdom or anything like that. It is all about how we can work together to promote better brain health, whether we are here or not here, because these hospitals would stay here for 300, 400, 500 years to the future.
The point is relative to the burden of disease that currently exists, that's increasing, and on the back of COVID-19, where we don't know what the real magnitude of ongoing consequences will be in terms of, problems with the brain. I think, it's very short-sighted, and all countries will need to be on the front foot. They're going to need to be on the front foot of their disability services as well, and how they support people with disability, because these are, it's all tied into chronic conditions, whether it's MS, whether it's stroke, or whether it's, post-COVID-19 infection. We need to be at the front, on the front foot. We're on the back foot with ventilators and ICUs for the, dealing with the pandemic as it really rose and created a crisis. But now we've got to have the washout, and we've got to be ready and on the front foot. We can't keep being on the back foot.
Having said that, Dom, as part of this World Brain Day campaign during last 8 years or so, I had the good fortune of talking to some of the most brilliant brains worldwide, including you today. And you cannot go out of these discussions except to be super optimistic that despite the calamities that we face with, despite the challenges that we face with, the world has to be a better place. If we have such useful, fruitful brains, whether they put services in certain hospitals or not at the right time that we wanted them to be, I think we would get this job done. I'm optimistic that despite the crisis that we both live in at this point of time as a result of this virus, there are enough decent human beings to get this job done. And as you and me both see in the clinician, scientists, and academic communities globally seems to be way united, way before G7 summit and political leaders get together to address the vaccine issues. When Melbourne University discovered the genetic sequencing, they were very quick to share it with the whole world. And when vaccines came on board, there was sort of at least strategically the plans to bring vaccines to everybody. So I think it is up to us now to up the ante on our advocacy agenda to make sure that brain health get the same sort of the attention and agenda as it is important. If we keep good brains running this world as political leaders, this world would be a much more peaceful place. We have work to do in that regard, but let's see, we can see some bright signals in time to come. My other question to you, Dom, is tell us how you spare your pastime when you don't involve in stroke research or other things. What sort of things do you enjoy most when you are not working?
Oh, gee, am I ever not working? That's called work-life balance. Yes, I enjoy walking every day. So I really enjoy cooking as well, and just spending time with my family, whether that's camping or gardening, walking my Cocker Spaniels, which take up a lot of my time and attention, as well as my chickens in the backyard. So all these things bring you back to earth. They remind you that there are other important things to be doing, including, you know, keeping up with the washing. So, yeah, you know, I fill my days with different things. I enjoy, you know, pastimes like yoga, all the rest of it. It's finding a balance and making sure that you break up your busy life into periods that give you a break so you don't burn out, and that you also find the time to do the things you enjoy, including catching up with friends and family, because at the end of the day, when this career ends, you know, they're the people that are going to be around you to support you. And you want to know that you've still maintained fantastic relationships with them and not prioritize just one thing, because we are all, you know, I guess more than one thing, and we shouldn't always put all our eggs in the one basket and forget the importance of relationships and family, even when you have a very good career or profile, that shouldn't come at the expense of those relationships.
Absolutely. That's what make us humans. That's what maintaining humanity. Last question is, Dom, I think we touched upon this a few times as we were chatting away. I want you to think of all the young nursing students and nurses who work incredibly hard all over the world at this point of time. I remember during my internship and as a young registrar, the first thing that I would do if I'm on night shift is to have a sort of scan through what sort of a nursing colleagues that I'm going to work with tonight. Because you know that if you have really super duper pocket rocket hardworking nurses, your night is going to be peaceful. On the other hand, if it is not the case, it is going to be painful as whatever the medical subspecialty, it's a team game. It is not a one man or one woman show. But they continue to remain unsung heroes in most countries. So I want you to inspire them. What is your take-home message for them? I don't want you to make them all full professors or anything like that, but I want you to tell them that how they can most joy out of their profession and then make a meaningful contribution while enjoying their terrific work that they do in these difficult circumstances.
Yeah, look, I think seeking out mentors is really important, and that doesn't have to be within your own discipline. I think any discipline can support and mentor a nurse who has an interest in different areas of clinical work and or research, or wants to bring those two things together. So I think it's really important that you seek out mentors, you seek out people that you can trust to have conversations with. Try not to feel disillusioned with your career paths and the challenges that sometimes happen on a day-to-day basis when you're working clinically, and make sure you've got the people around you to debrief with. And if you want to advance projects and ideas, reach out to people. It's not hard. Sometimes it's just half an hour with someone that's got some experience on doing projects or setting up a database. But try not to reinvent the wheel, and you know, utilize your colleagues and reach out to them. And if you've got a good idea, put it forward. Don't be afraid to think of something that might help improve patient care or the way the team is working. And, you know, there is never a dumb question. So I think seek the support, reach out to colleagues, reach out to peers, and make sure that we can get the evidence base around the contributions of nurses to neuroscience clinical management.
And would it be fair to say that you would be happy to receive emails if nursing or other colleagues from sub-Saharan Africa or Asia or Latin America or any part of the world who wanted to reach out to you? If you're not super busy at that particular time, you're happy to receive those emails?
I'm always happy to receive emails. When I get to answer them is another question, but if I can't answer something, I will usually connect the person up with someone else that can provide support for that particular aspect that they might have been coming to me for. So that's all good. I'm part of a broader network of academic nurses and clinicians, and I can certainly help point people in the right direction if that's what they're wanting.
Dom, thank you so much for giving us your time out of a busy schedule during this crazy time. And thank you for supporting our ambitious World Brain Day campaign also. We are trying our very best to break the 150 million mark this year. But our first goal is to see 2.8 million social media posts. So your fan club can visit to World Federation Neurology web page. They can just Google it, and we have created the thing called Toolbox. In the Toolbox, what we have done is we have created the press release. We have created a whole lot of social media posts trying to cover the global population with different images. They're all available for anybody to download. We don't hold any copyright. They can be linked with individual organization logos and other things. What we wanted to see is people posting about brain, supporting brain health, endorsing brain health, and get this number go up and up and up. Eventually, hopefully, we would get close to half the population in the world interested in brain health. And that would help us to have a healthy one world where we promote better brain health globally. And stay well and stay safe. And we look forward to catching up with you some other time on a different project later on.
Thank you, Tessa. Thank you very much for inviting me for this interview and helping support World Brain Day.
Thank you so much, Dom. It is always a pleasure to chat to you. Take care. Stay well and safe.